Now we good. Listen, this Punta Cana connection better strengthen up. All right, y'all. Let us pray. Let us pray. All right. How y'all doing today? Happy Thursday. I don't know why I keep wanting to call it Thursday Hump Day, but that's not the correct date. It's just not. All right, y'all. Let's go ahead and get our game together. How y'all doing today? All right. So if you are here, hopefully you are here for some good NCLEX Jeopardy. All right. Some good NCLEX Jeopardy. Now, I am mid-vacation. I come back tomorrow, but I am mid-vacation. So, y'all lucky we're not on the beach, because honestly, it getting dark is what brought me inside. All right, y'all. So let me go ahead and put it up for everyone so y'all can see what we're doing. All right. This isn't really don't click it. It's not going to do nothing. Don't click it. It's not going to do nothing. But yes, welcome to NCLEX Jeopardy. Hello, Juliet. All right, guys. So all my first timers, if this is your first time at NCLEX Jeopardy, please let me know below. Comment below that this is your first time during NCLEX Jeopardy. I'm going to go over kind of like the house rules so that everyone can kind of be refreshed and know. Okay, last month, during the month of September, we did something a little bit different for NCLEX Jeopardy. Every time we did it, it was focused, like all the questions were focused on like one specific content area, a topic that we were covering. So like week 1, we did like nursing skills clinicals. Week 2 was med-surg cardiac. Week 3 was med-surg endocrine. And then week 4 was maternity. But this week and for the month of October, we're going to go back to like the comprehensive review. Okay, so our topics are going to be pharmacology, pediatrics, mental health, fundamentals, and adult health. Those are going to be our topics for today. Okay, now I do have dinner reservations at like 8, so we're going to be we're going to go just a little bit quicker. Okay, but as always, if you guys want to play the full questions, the full 25 questions, you can download the NurseSam app, which is free to download, and you can play the full practice. All right, this is just our group review, so we can have fun and play for prizes. All right, so a couple of house rules. I see a lot of first timers. What's up? Thank you guys for joining me. I'm so glad. All right, so this is how we're gonna play NCLEX Jeopardy. Ooh, go back to it. All right, so I'm going to put the question up on the screen. The app is called the NurseSam. It's in my bio, link in my bio. It's on my page, the link to get it. Or you can search your app stores, whether you have an Android phone or an Apple phone. Just search the NurseSam, and you'll see the NurseSam app pop up. Download that app. And then go to NCLEX Prep. You'll see NCLEX Jeopardy mobile game. You can play the mobile game. The questions that we're about to do now, you will not see in the app. Those will be uploaded to the app after we get through our questions. Okay, so last week's questions are still there. So, like I said, house rules. I'm going to put up the question and the answer choices. All right, we're going to go through the actual like answer and the rationale. We always go through the rationale. Okay. The person that answers the question correctly and first, and the answers correctly is going to be the winner of those points. All right. So I'm going to pick a topic, and then I'm going to pick the like points for it. So let's say I do fundamentals for 200 points. I'm going to pick that question. That question is going to come up. The first person to type down below in the comment after they read the question, first person to type, the correct answer, and because this is Jeopardy style, you have to say what is. All right, so let's say I pull up fundamentals for 200, and you read through 1, 2, 3, 4. The options are going to be 1, 2, 3, or 4, or A, B, C, and D. Depends on if it's like numerical or not. And if you think that the answer is B or number 2, then you're going to put what is B or what is number 2. Make sense? Little tip. Always going to give you guys a little tip. Because we're playing for prizes and incentive, just to make it a little bit more fun and entertaining and competitive on a friendly level, we're playing for points. So whoever answers that first and correctly on my screen is going to be the winner of those points. Okay? Whoever has the most amount of points at the end of this game is going to be the winner of a free either NCLEX Arcade or Ultimate Nursing School bundle. Okay? Hold on, I'll get one thing. 1 second. I don't even have a pen. All right, never mind, because I did not have a pen. That's fine. All right, so now I will say this for all my first timers, just in case, like, let's say Susie and Jacqueline answer. All right, on my screen, Susan answers first and then Jacqueline answers right behind. But on your screen, because of like connectivity issues or maybe just delay, maybe Jacqueline answers first, then Susan. I can only go by what's on my screen, so the one of those points is gonna go to who my screen says answered first. Okay, mind you, on the actual NCLEX, it's not Jeopardy style. It's not a race to the finish, who answers first. None of that. That's just how we're gonna play, just to make it a little bit more fun. Okay. And people were asking me if this was good practice for the NCLEX, like the new NCLEX for next year versus the NCLEX the current style of the NCLEX is for both. Content is going to be the same, okay, but this is really going to be beneficial for everyone that's taking the current style of NCLEX, which is anywhere from now up until April 1st, 2023. Okay, content's going to be the same. However, how you're going to be asked, the question style is going to be different. Okay, but we'll touch on that. We'll go over that at a later date. But for now, this is for the current one. Cool? All right, so if that makes sense and you guys are ready to play NCLEX Jeopardy, give me a thumbs up. Comment a thumbs up in the comments right below. Thumbs up if you are ready to play our first question of NCLEX Jeopardy. Okay. Now, if you have any other questions that I have not answered, please drop them down below anytime you see fit. And either I'll answer or somebody that knows the answer is going to go ahead and answer you. Okay. All right. So I'm getting my thumbs up. So let's go ahead and get started. Okay. Okay. Here we go. All right, another thing. You don't have to wait. When I do put up the question on the screen, you don't have to wait for me to read the whole thing for you to answer. Okay? All right, so let's go ahead and get started. And our first question is going to be, let's do pharmacology and let's do it for 400 points. Okay? So let's go ahead and get started right here, right now. All right. Pharmacology for 400. The nurse has given medication instructions to a client beginning carbamazepine. The nurse determines that the client understands the use of the medication if he makes which statement? 1. I will use sunscreen when outdoors. 2. I can drive a car as long as it is not at night. 3. I will keep tissues handy because of excess salivation. Or 4, I will discontinue the medication if fever or sore throat occurs. Okay, now, for all my loves who's first time, first of all, thank y'all so much for joining me. All right, in case y'all didn't know, hello, I'm Nurse Sam. Okay, but my tip is always going to be no matter what content area, no matter what topic, no matter if it's NCLEX, T's, SAT, doesn't matter. Always have your strategy in addition to your content when you're doing these types of questions, okay? Just so you actually know what the question's asking and you don't confuse yourself. All right, so always reread at least the last line of every question so you can remind yourself of what the question's actually asking and what it wants you to answer versus what you came up with in your mind. Okay, it happens to the best of us, so it's okay. All right, so from the looks of your answers, I'm getting anywhere between what is 1 and what is 4. I am getting like a smooth like half and half. Okay. Let's look and see what that answer is. All right. Carbamazepine is the medication. It says the nurse determines that the client understands the use of the medication, carbamazepine, if he makes which statement. So we're looking for a statement that is true and correct about this medication, especially dealing with patient education. Okay. All right, so let's look and see what that answer is. Pharmacology for 400, and drum roll please. And the correct answer is what is 1? All right, the answer is what is 1. I will use sunscreen when outdoors. All right, I will use sunscreen when outdoors. Thank you, Avery. I'm glad you love this. We do this every Thursday. It's super fun and super helpful. All right, let's see who got what is 1 first. Hold on, let me scroll all the way up. And if you said A instead of 1, I know what you mean. So, first person to say what is and then the correct answer was actually Bombshell 16. How do you spell this? Yep, Bombshell 16. Awesome job. So, Bombshell, you have 400 points on the scoreboard. Great job. Now, like I said, on the actual NCLEX, you're not playing for points. You're not playing for, it's not Jeopardy style. As long as you are getting the answer correct, this review is working for you, okay? So just in case you don't really want to play for points or don't want to play for the free NCLEX Arcade or Ultimate Nursing School Bundle because either you have it or maybe you took your NCLEX already and this is just a review, you don't have to say what is. All right. So if you just said either A or 1 and you got the answer correct, you are comprehending the material. Okay. If you did it and you got it wrong, don't beat yourself up. I'd much rather y'all get it wrong with me on this fine Thursday night. I'm in my bathing suit. You're at home in your bed. You put Jeffrey Dahmer on pause. I'd much rather you make a mistake with me now than on the actual NCLEX where there's no turning back. Okay, so who else got what is 1? Any but I choice. Lovely D, Tia, Allure World, Hey Boo, Whisper 22, Miss Fifi, Wildflower, Ray, Avery, Listen Linda, Tiara, Black Bonnie, Nurse Jocelyn, J Dollars, Just to Bless. Awesome job. So great job. So this is the actual rationale. And this is the point where y'all definitely need to be taking notes, okay? Especially if you got this wrong. Because if you got it wrong, that means you just need to brush up on the material, and that's fine. Just, you see what you got wrong, you see why you got it wrong, so that next time you won't get got. Cool? All right, so the answer is, once again, what is 1? I will use sunscreen when outdoors. Carbamazepine is an anticonvulsant, aka anti-seizure medication. Okay, the client should use protective clothing, like I have this on, protective clothing and sunscreen to avoid photosensitivity reactions. Carbamazepine acts by depressing synaptic transmission in the central nervous system. Because of this, the client should avoid driving at any time, whether it's day or night, or doing other activities that require mental alertness until the effect of the medication on the client is known. Okay, so y'all know whenever you see medications that may make a person drowsy, whether it's a narcotic or whether it's just something that will just have you a little loopy, until you know how that medication affects you, they don't want you driving, operating heavy machinery, signing legal documents, none of that. Don't do that and then blame us, because you was out cuckoo for Cocoa Puffs that day. No. So they want you to avoid any type of driving, whether it's daytime, nighttime, midday, evening. Don't drive, okay? It says the medication may cause dry mouth, and the client should be instructed to provide good oral hygiene and use sugarless candy or gum as needed. It says the medication should not be abruptly discontinued because this could lead to return of seizures or status epilepticus. Okay? Little tip, on any type of anticonvulsant medicine, you never want to just abruptly stop that. Okay, whether that's carbamazepine, whether that's what's another anticonvulsant, Devalprex or something like that. Any type of anticonvulsant, you don't want to abruptly stop, because that's essentially what that's going to do is just almost like shock your system to the point where you have a seizure, right? So you don't want to do that. Abruptly stopping it is never a good thing for whatever reason. If you need to discontinue that medication, you need to speak, or you need to instruct the client to speak with their physician so they can work on safely weaning them off of that medication. Abruptly stopping it will cause an abrupt seizure. Period, point blank. Okay? Now, as far as the dry mouth, here's a little tip. Whenever you see a question about pharmacology and about any type of med, whether it's, like I said, any type of med, any class, and it's talking about side effects, adverse effects, whatever, whenever you see something about oral hygiene, dry mouth, because one of the big side effects of, let me say this, one of the big annoying side effects, not life-threatening, but it's pretty annoying, is dry mouth. So a lot of patient education, a lot of patient teaching is going to go towards how to, teaching the patient how to remedy that dry mouth. Okay, so that's why they said good oral hygiene and sugarless candy or gum to chew on that, suck on that, to help relieve that dry mouth. Okay, excess saliva, I don't really know a medication that's gonna cause excess saliva to the point where you need a patient education. It's usually the opposite. So just saying that. Sam, are you on vacation? I still am on vacation. I'm still bringing out a lesson. Exactly. Love y'all down. Exactly. Thank you for pointing that out, Dream Candy. Okay? Because I took a break from my drinking and relaxed in the sun because I want y'all to make sure y'all got this review. Cool? All right, guys. Congrats again to Bombshell. You're the first person to get that one. Let's go ahead and get to our next topic, or our next category. I'm sorry. All right. If y'all have any questions about anticonvulsants, carbamazepine, any of that, just let me know. But make sure you're writing down all the little gems that I'm giving y'all. Okay. All right. Next question. Let's go. Let's do pediatrics for 300. Y'all ready? Boop, boop, boop. Joey said, does MS meds cause excessive saliva? Did you mean MS, like multiple sclerosis meds? Let me know what you mean. But let me read this question real quick and then I'll get back to you. All right, pediatrics for 300. Cholinergics. So anticholinergics cause dry mouth. Cholinergics, which is the opposite of the anticholinergics, cause excess salivation. Or drooling, let me say that. All right, so pediatrics for 300. The nurse is verifying that a mother understands how to care for her infant who has thrush. Which comment by the mother would indicate that further teaching is indicated? 1. I will feed my baby before I apply the medication. 2, I can put the medication in my son's bottle for him to drink. 3, I need to thoroughly clean bottles and nipples after every use. Or 4, I will slowly put the medication in each cheek of my baby's mouth. What is our answer? Remember I said, go back and read at least that last line. Okay, which comment made by the mother would indicate that further teaching is indicated? All right, when we see the term further teaching is needed or further teaching is indicated, I put this in my stories. Are we looking for the right answer or are we looking for the wrong answer? When we see, or when a question is asking us to identify the comment that suggests that further teaching is needed, are we looking for a comment that is a true statement, or are we looking for an incorrect or false statement? Okay. Lots of people is either saying either 2 or 3, child. Right. You're looking for the wrong answer. All right. Just break it down. Which would indicate that further teaching is needed? If somebody got something, if somebody understands something, do you need to further teach them about it? No, they got it. So you move on. But if they sit up here and say, well, 2 + 2 is 6, girl, let me teach you some more. Further teaching is definitely needed. Okay? So, and I say that because when it comes to further teaching, that can confuse people a lot. All right? You can go, as you're going and reading through the option choices, you sit there and you go and you somehow, even though you read that you're looking for further teaching, and maybe you say in your brain, okay, I'm looking for the wrong answer. As you read, by the time you get to the 3rd one, you're looking like, okay, let me find the one that's right, because that's the usual thing that you do. To help that, every time you read an actual option, ask yourself if this is true or false. I will feed my baby before I apply the medication. Is this true or false? And then answer. And then do that for each one so you don't trip up and mess yourself up. Okay? So let's go ahead and see what our answer is. Peds for 300. What is 2? I can put the medication in my son's bottle for him to drink. I can put the medication in my son's bottle for him to drink. That statement would then initiate the nurse to continue her teaching, his or her teaching, because they didn't get it yet. That's an incorrect statement. All right. Let's go ahead and get into it. Well, first, before I get into it, let me go ahead and see who got this one first. What is 2? Whisper 22. First person to get it. Congrats. All right. So Whisper 22, you're on the scoreboard with 300 points. Who else got it? Dream Candy, Tiara 88, Leah, Joey Keys, Tia, Veronica, Wallflower, Bijou, Cardio Barbie, Ray, Alexis, Bombshell, Cat's Fitness Journey, NP, Porsche, Listen Linda. And then Bombshell, you changed your answer to what is 1. Ooh, remember I said about changing those answers? Let me repost that thing. All right, now let's get into the rationale as to why the answer is what the answer is. All right, so thrush. What is thrush? Y'all know what thrush is? For all those that don't have babies. Okay, thrush is a fungus caused by Candida albicans. It's a yeast infection in your mouth, basically. I know. It honestly, that's just what it is. The white patches resemble mild curds and are visible on the tongue, inner lips, oral mucosa, and gums. Okay? An antifungal topical medication may be prescribed and needs to be slowly administered in each cheek of the baby's mouth after eating to increase the time that the medication is in contact with the mucous membranes. Okay? It is not placed in the baby's bottle. Why? This action does not provide the topical treatment that's needed. They're just going to drink that thing. Okay? No. When it comes to thrush and the anti-fungal medication, once again, it's a topical medication. So it needs to sit on top of the mucous membranes in order for it to actually be effective. So if you put it, if you like maybe apply it and then either eat right after, drink right after, that's disrupting that medication from doing what it needs to do. All right, so it needs to be in contact with those mucous membranes for as long as possible. All right, placing it in the baby's bottle, it's not going to provide the topical treatment needed. And then it says, additionally, medication is not added to a child's bottle because, first of all, the infant may not even finish drinking everything from that bottle. Okay, they can get to like after a couple, especially if you don't really know if they really don't want a bottle. Have you ever tried to give an infant a bottle that did not want the bottle? That bottle will then be either over there, at your head, oh, who knows, over yonder. It's not staying. Okay, so as much as you want that infant to go ahead and drink your bottle, drink all of it, there's medication in there. If that baby does not want to have that bottle, trust me, it's not going to stay in their mouth. Okay, so you don't want to add medication to a bottle that they may not even keep in their mouth. So that's why typically adding medication to a bottle while you think you're being slick, that baby is slicker. Okay, and then it says, one second, who is it? My fault. All right. And then it says, all bottles and nipples need to be thoroughly cleansed, or thoroughly cleaned after every use to prevent further infection. Because, I'm going to ask y'all a question real quick, because this may be a question that may pop up about thrush in pediatrics. What is a common way that infants even get thrush? What is a common way that infants even get thrush in their mouths? It's usually by an action that you think is just perfectly fine. Like you don't have people going and saying, oh, this is yeast infection candy, go ahead and suck on it. That's not how they usually get it. But this has to do with like patient education, patient teaching, especially to like new moms. Yeah. What or how does an infant usually or commonly get thrush? Right. I am the ambitious one. From milk. And it's from milk, from going to sleep with their bottles. Right. Dirty bottles or kisses, bottles aren't cleaned properly, not washing the bottles correctly, breastfeeding, going to sleep with that bottle, bombshell with the antibiotics. Yes. A big one that's usually seen on the NCLEX, I'm going to say this, I've been doing this for 2 years. NCLEX Jeopardy every Thursday for about 2 years. Okay, I have seen, I feel like almost every NCLEX question ever. What's usually seen on the NCLEX is going to sleep with bottles, like giving the baby a bottle to go to sleep with, and then going to sleep while sucking it. That's usually like almost like the number one way to get thrush. Okay, so that has to do with teaching. So you would teach that mom and educate that mom to refrain from giving the baby a bottle to go to sleep with. Okay? Besides like aspiration and all that good stuff, just that milk just staying in their mouth overnight, that's what's gonna cause. Right, and it causes the tooth to rot as well. Absolutely. So just put a little star, because that's usually assessed, whether it's on the NCLEX or whether that's in like your pediatrics course or class, that's gonna be touched on. So just little star, okay? All right, let's go ahead and get to the next one. That was peds for 300. Let's get into mental health. All right, mental health for 300. The nurse is caring for a client diagnosed with schizophrenia who states, I decided not to take my medication because I realized that it really can't help me. Only I can help me. Which question asked by the nurse has the best therapeutic value? 1. Why do you think this is a wise decision? 2. I don't understand. Only you can help you? 3. You've decided not to take your medication. Is that right? Or 4. Do you recall what it was like before you started your medication? Once again, let's read that last sentence of our question. It says, which question asked by the nurse has the best therapeutic value? All right, situation-wise, we have a client diagnosed with schizophrenia that stated that they decided just not to take their medication because they realize that it can't help them. Only they can help them. Okay, so the question is asking for the response that is the best therapeutic, that has the best therapeutic value. Okay, now when it comes to mental health, mental health is difficult because it's not as cut and dry as this is your issue, here's your solution. You're itching, here's some here's some anti-itch cream or hydrocortisone cream. It's not that cut and dry, okay? Just like almost with priority questions, you're not gonna get options that are like just plain outright wrong. Sometimes you will, but you're looking for the one that has the best therapeutic value, okay? So I'm seeing lots of people say 4. Do you recall what it was like before you started your medication? Awake Thy Soul said start a conversation. Dream Candy said 3. So I'm getting majority 4s, but I'm getting 1s, 4s, and 3s. So let's go ahead and see what that answer is. By the way, is anybody taking mental health this semester? Hands up. Is anybody taking mental health this semester? All right. Let's go ahead and see what our answer is. Mental health for 300. Drum roll, please. What are we saying to our client with schizophrenia that just decided to just up and stop their medication? I almost said something, but that was rude. And Kanye's not schizophrenic, I don't think. I think he's definitely bipolar. So I was gonna make a Kanye reference, but that's not even accurate. Anyway, the answer is what is 4? The answer is 4. Do you recall what it was like before you started your medication? All right, so let's get into this. Non-compliance with antipsychotic medication is one of the chief reasons that clients with schizophrenia have relapses. Okay, the most therapeutic response is to initiate a conversation with the client directed towards discussing the advantages of being non-compliant. You got to know who you're talking to. Okay, you got to know what can possibly escalate or aggravate a client with schizophrenia, because what aggravates a client with schizophrenia isn't going to be what aggravates a client without schizophrenia or with maybe another mental disorder, maybe like bipolar or something. Words mean things. Diagnoses, they mean things. Okay, they mean different things. So how you approach each of them is going to be different. Okay, what do you know about schizophrenia? Clients with schizophrenia, right? They usually have not necessarily hallucinations, but they usually believe things that are not real based off of hallucinate. Let me get the actual. Is it hallucinate? Yep, delusions. That's what I'm thinking about. They usually have delusions, hallucinations, disorganized thinking, and they usually think that someone's out to get them. Like, it's usually negative thinking. They think that something's going to harm them, and the only way they'll be able to be safe is they can only trust themselves. They're very non-trusting. So Like I said, once again, know your client. Know who you're talking to. It says, while it is therapeutic to use communication techniques like restating and clarification, which is usually where it goes, usually the answer, but once again, know who you're talking to. All right? They specifically said a client with schizophrenia, not a client who stubbed their toe, not a client with multiple personality disorder, specifically with schizophrenia. All right? It says, in this specific case, it is not useful to this client since the intent of the behavior is already understood. Asking a why question is usually viewed as argumentative. And the last thing you want to do is argue with somebody with schizophrenia. Okay? Now that I think about it, are we sure? No shade, for real. Are we sure Kanye is not? Because y'all saw Kanye's rant, right? Every week on Shade Room. It's every week on Shade Room. Okay, and we're just like, who are you talking to, my love? Like, are you okay? So challenging, because I'm thinking about, not necessarily Kanye, but I'm thinking about the actual, like a client with symptoms that Kanye exhibits, right? Asking a why question is usually viewed as argumentative. You do not want to argue with someone with schizophrenia. Okay? Absolutely not. You just don't. Not even in a safety type thing, which sometimes it does escalate into, violence. But you want to, like, trust, and gain that trust is definitely what you're gonna have to work like 3 times as hard with a client with schizophrenia, because they don't if they don't trust this medication, they're not gonna trust the person giving them the medication that they think is not gonna help them. Does that make sense? So therapeutically, what you have to do is try to figure out why they think that this, not that the medication is going to hurt them. They already said that, but you have to figure out their thinking. But not asking why, right? Don't ask them, hey, why do you feel this way? They just said it. I just said that I'm not taking this because it's not going to help me. Okay, so then your response will be like, well, what was it like before you started your medication? You got to find ways to kind of urge them to see why it actually won't be beneficial for them to continue their medication. Instead of just telling them, it's like you got to let them come to it on their own. And you, therapeutically, as a nurse, you have to word your words, word your sentences, watch what you say, and just say things in a way that's going to gently push them. Not gentle parenting, but gentle nursing. You got to push them to that decision themselves. Does that make sense? I know. That's why mental health is usually like, mental health will have you evaluating your own mental health. Okay? All right. Did I say who got the answer? 1 second. I sure did not. Hold on 1 second. Who got that first? What is for? Whisper 22? Yeah, wait. No, yeah, I'm right. Okay, Whisper 22. You had 300 points. You have another 300 points. So now you have 600. Who else got it? Dream Candy, Bombshell, Tia, Ray, Leah, E-Love, Awake Thy Soul, Mary, Logan, Wallflower, J Dollars, NP, Poochie, Sweet Over Summer. Awesome. All right, great job, everybody. Let's go ahead and get to the next question. What was that? Mental health. Let's get into MedSurge. MedSurge says, I'm taking my NCLEX on the 28th, so I love this. Oh, okay, because I was about to ask you, Whisper, when is your NCLEX? Because you about to kill it. You are about to kill it. Which reminds me, let me ask that question too. All right, so MedSurge for 100. Good luck to you, Whisper. Okay, when's the 28th? In 22 days. I'm going to check on you too. The nurse is reviewing the discharge instructions for the client who had a skin biopsy. Which statement, if made by the client, would indicate a need for further instructions? We just talked about this. Okay? Remember my tip. Whenever you see a need for further instruction, ask yourself, true or false, every time you read the option, just so you don't confuse yourself. All right, so let's do it. 1, I will keep the dressing dry. Is that true or false regarding skin biopsy? 2, I will watch for any drainage from the wound. True or false regarding skin biopsy? 3, I will use the antibiotic ointment as prescribed. True or false? Or 4, I will return tomorrow to have the sutures removed. True or false regarding a skin biopsy? All right, it looks like everyone is saying 4. I have some people saying 1, but the majority of everybody is saying 4. So we're either all wrong or we're all right. Okay, let's look and see. All right, what is our answer? Oh, sorry, I was looking at the answer to something wrong, and I thought we was all wrong because I chose 4 too. I was about to be real upset. I was about to be real upset. But yes, the answer is 4. There we go. Now you. I suggest doing that every time you get a question right. You got to celebrate the small wins because you got to take it how you get it, honey. But yes, what is 4? Great job, everybody. Let's see who got this one first. Okay, Whisper. Whisper came to gather all the coins. So this one's 100. All right, so Whisper, you just got like 3 in a row, right? You better rack up these points, honey bun. You had 600, now you have 100 points added for a total of 700 points. All right, it can still be anybody's game. It's okay, we're not done yet. We're almost done, but we're not done yet. Who else got what is 4? Joey, Bomb, Leah, I'm the ambitious one, Mary, Miss Fifi, Wildflower, J Dollars, Dream Candy, XDV, Awake Thy Soul, Bankroll Cast, MP, I just said you, Lannaberg, Future ER Nurse, Hey Boo Hey, Antoinette, ew. There we go. All right, great job, everybody. So it says, what is 4? I will return tomorrow to have the sutures removed. So sutures usually are removed 7 to 10 days after a skin biopsy. Pause. Where are y'all? What semester are y'all in? Just comment below what semester you're in. Because have y'all been to clinicals yet? Or have y'all did the skills where you have to remove sutures? Oh, it is so fun. It is so fun. Anyway, let's go back. Sutures usually are removed 7 to 10 days after a skin biopsy, depending on the primary healthcare provider preference, but usually 7 to 10 days. It says after a skin biopsy, the nurse instructs the client to keep the dressing dry and in place for a minimum of 8 hours, as prescribed. After the dressing is removed, the site is cleansed once a day with tap water or saline to remove any dry blood or crusts. The PHCP, or primary healthcare provider, may prescribe an antibiotic ointment to minimize local bacterial colonization. The nurse instructs the client to report any redness or excessive drainage at the site. Why? Why does the nurse instruct the client to report any redness or excessive drainage at the site? Drop it below. This is the site may be closed with sutures or may be allowed to heal without suturing. Okay? So yeah, number 4 had it messed up because it said, I will return tomorrow to have the sutures removed. Baby, let it heal. If you have to return tomorrow to get these sutures out, why did we even put them in the first place? Like, what? Right. All right, thank y'all. So the nurse instructs the client to report any redness, excessive drainage at the site because of signs of infection. Okay? And I say this because remember that whether it's the new NCLEX, the current NCLEX, the theme of the NCLEX is client safety. Okay? So the questions are coming to you, the questions that they're asking, they're making sure that you know how to A, operate within your scope of practice with an RN and an LPN, and B, you know within your scope of practice how to keep yourself and these patients safe. Okay? So anything that has to do, anything that could possibly harm them. They're going to make sure you know the signs and symptoms of what could possibly, like of a little small little thing that could possibly get out of hand and cause harm, if not worse. All right, so the nurse instructing the client to look out for redness, excessive drainage, swelling, heat. That's going to be your signs of a possible infection, which you need to report. Document and report, okay? Love you, Lauren. See y'all next week. All right, great job to everyone this infection. Did as a medical assistant. Future ER nurse, did you do it like in a like a sports like ortho thing? That's what I did. All right, let's get it into our right. All right, let's go ahead and go to our next question. What was that, y'all? Med surg. All right, let's go to the fundies. Fundamentals for 100. All right, the nurse is teaching a client about what to expect during a gallium scan. The nurse should include which item as part of the instructions. 1, the procedure is non-invasive. 2, the client must stand erect during the filming. Y'all know what erect means. Anyway, 3, the procedure takes about 30 to 60 minutes to perform. Please don't report me. Please do not flag my account. And then 4, the client should remain on bed rest for the remainder of the day after the scan. Let's read back through it. The nurse should include which item as part of the instructions for a client about to have a gallium scan. Okay. So when it comes to fundamentals, let me not say that. Let me just say about this question. This question in particular, you just honestly just have to know what what a gallium scan is. You can make your you can like take guesses and stuff like that, but this is one of the questions where like you can't really like take an educated guess. You either know what a gallium scan is or you don't. You can process of elimination, but in order to answer this question, you have to know what a gallium scan is. And honestly, either you do or you don't. But that's why we do these. I'm gonna say right here, I don't remember what the fucking gallium scan is. I have no idea what a gallium scan is. I'm about to Google it in 2 seconds. But that's why you do your practice questions. So you can come across all this unknown stuff that maybe you have not seen, remember, don't remember. But in order to answer this question, you gotta know what a gallium scan is. And after we answer this, you're about to know what it is in about 3 seconds flat, okay? All right, so let me see what y'all saying, because I never heard of it. I don't remember what that is. All right, let's look and see, because I don't remember. Gallium scan. Boop. What is 3? What is 3? You know, that's what I thought it was, for real. That's what everybody's saying, right? I was going to say that. Oh, I was going to say number 3. No, damn well you was not going to say number 3. All right, so it says the procedure takes about, the answer is what is 3. Gallium scan takes about 30 to 60 minutes to perform. I learned something new every day. Now I know, because it's Mike's Super Short Show, what a gallium scan is. All right. So a gallium scan requires the injection of a gallium or of gallium isotope 2 to 3 hours before the procedure. Therefore, the procedure is invasive. Oh. I'm not being gonna lie. I think I said it. I was like, what is a scan? I was like, scans aren't invasive. It's just a scan of your body. It's not invasive. But there's an injection of a medication that's making it invasive. Bombshell said we did not learn this in fundamentals. Period. That's how NCLEX be coming for you. All right. It says the procedure takes 30 to 60 minutes to perform. The client will be, the client will lie down, so the client is not erect. Anyway, the client will lie down during the procedure and must lie still. Ooh, it's giving like MRI, giving CT scan. I gotta look. And then it says there is no special aftercare. Let me look what a gallium scan is. Is the gallium scan the thing that like makes, like you poop out white stuff? I don't think so. Oop. Oop. No, I don't think so. Anyway, a gallium scan, I just Googled it, y'all, so we all can learn, because like I said, I'm not gonna say I didn't learn about gallium scan, but it wasn't like, we didn't spend a lot of time on it. It was probably like in my textbook, but I just read past it because it was not one of those commonly tested things. All right, it says a gallium scan identifies the cells that are dividing most quickly in your body. Okay, so real useful in detecting what? If a gallium scan identifies the cells that are dividing most quickly in the body, you can expect that gallium scans are used to detect what? Like what? Thank you. I don't know how to say it. Cancer. Okay. Gallium scans help detect cancer cells. Some cancer cells, whatever. All right. It says it can show cells that are rapidly reproducing or responding to an infection somewhere in your body. So people with like lymphoma, that type of cancer, which is cancer of the lymph systems, they usually or may need a gallium scan. That's how you identify that specific type of cancer. We learned something new today. Okay, so when you see gallium scan, think of scan for cancer. And then somebody said something about, thank you, Awake Thy Soul. Pooping white is from barium scan. It's giving critical thinking. It's giving critical thinking, and I'm loving it. Okay, I'm loving it. Awake Thy Soul. I don't remember this at all. Me neither, which is why we went over it today. Now we know. Okay. So who was the person that won this one? What's this? Fundamentals for 100? All right. Let's see who did this. Boop, boop, boop. Ooh, it's giving critical thinking, and I'm loving it. That's exactly why we do this. What was the answer? What is 3? So who was the first person to either guess? What is 3? Because I bet y'all did not know what this was before the answer slide. And that's fine, because I did not. All right. Future ER nurse. Future ER is an underscore. Yep, underscore nurse. Love it. So great job to you. Great job to Sweet Persuasion. Great job to J Dollars, Immaculate Michelle, Lunaberg. Great job. Wildflower said 3 was gonna be my first guess. For real, for real. I promise you, I believe you. It's just funny because that's exactly what I said. All right. So I definitely guessed. That's fine. All right, guys. Next question. That was funny. All right, last question, guys. Now I gotta go get ready for dinner. Mental health again for 400. Definitely guessed. The amount of questions on nursing school exams and NCLEX that we actually guessed. Okay, we won't disclose what that is, especially during the first semester. We won't disclose that. All right, so A homeless shelter has sustained severe damage as a result of a fire, and most of the structure and people's belongings were destroyed. Ooh, it's giving Hurricane Ian. 10 of the individuals and people's belongings, 10 of the individuals who are being displaced have a history of chronic mental illness. The mental health team coordinating support initially should focus their efforts on which action? 1. Assessing the client's need for supportive therapy. 2. Evaluating the clients for signs of stress overload. 3. Providing the clients with shelter, clothing, and food. Or 4. Planning means for the client to receive their medication. All right. It says the mental health team that's coordinating support initially should focus their efforts on which action. All right. Remember, this is mental health. You got to know who you're talking to. You got to know who you're talking to. All right. So let's look at the situation as a whole, right? We have a homeless shelter that sustained several severe damage due to a fire. The homeless shelter itself was destroyed. People's belongings were destroyed. And because this homeless shelter, the structure was destroyed, now we have patients that are, or people that are displaced. They no longer have a temporary home. That homeless shelter is now gone. So now they're just exposed to the elements. Okay? Stressful situation, correct? Right. For anybody, whether you have mental illness or not. Okay? Stressful situation. All right? Now, on top of this very stressful situation, all right, 10 of the individuals that are being displaced have a history of chronic mental illness. Another note. Wait, what Dream Candy said? Don't make me laugh. Please have that mental. Go in the corner. Time out, ma'am. All right, so it says, what is it? Oh yeah, another note. Whenever you see like descriptive words, descriptive like adjectives before an illness, take note. Okay, chronic mental illness is different from acute mental illness. Okay. What's that? Y'all know the difference between chronic and acute, right? All right. So chronic mental illness means that long-standing. Okay, it's not new. This is not the first time we've been over this. Not been over this, but it's not the first time that we're discovering this information, or they're dealing with those symptoms. They have a chronic, which usually is like lifetime mental illness. Okay, due to this fact. All right, so we have somebody with a chronic mental illness that now has, acute or short term. So we have somebody with a long-term mental illness that now is dealing with this overload, but is now dealing with this influx of stress due to stuff being gone and then being displaced from a homeless shelter. What, due to that, due to those facts in that situation, what should the mental health team initially, which means first, priority, okay? What should be their priority focus due to this? All right, let's see what that answer is. All right, and the answer is, what is 3? Which is provide the individuals with food, clothing, and shelter. The answer is number 3. Let me see what we got first. Boop, 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 boop. A lot of people said 2. A lot of people said 1, but a lot of people said 2 as well. First person to say what is 3 is future ER nurse. All right, future ER nurse, you just got another, 400 points added. So you have 500 points. Who else got what is 3? Antoinette, Freckled Gal, Immaculate Michelle. Great job. Priority focus is number 3. Food, clothing, and shelter. Monique said that would be a caseworker or another department's job, wouldn't it? But remember, when it comes to the interdisciplinary team, everybody works, like there's still a common goal. So whether or not they're the ones that's actually doing it, that's still the before mental health can do their part, they have to make sure that this stress-producing event is as minimized as possible, or else everything that the mental health team has or is supposed to do will not be effective. Does that make sense? So they got to not get rid, but they have to solve the initial problem first, whether that's, social worker, it doesn't matter who does it, Santa Claus, Easter Bunny, it really don't matter. But that just needs to be solved. Does that make sense? All right, so it says the victims of community disaster, remember, it was a fire, homeless shelter. The victims of community disaster are at risk for stress-induced psychiatric crises. Okay, I don't know about y'all, but sometimes when there's too much going on, when there's too much stress, aka nursing school, I know y'all be having breakdowns, because I still have breakdowns, and I've been out of nursing school for 8 years. Okay, so just think about how quick you were are to have a breakdown dealing with the stress that you already dealing with, and something else happened. Like you could stub your toe and be crying for about the next 8 hours. Like, I just cannot take it anymore. Okay. It says the needs of these individuals for food, clothing, and shelter should be addressed first to minimize the stress-producing effect these losses may have on the chronically mentally ill. Okay, so you can be coming up to the mental health team can be coming up to them being like, look, you still homeless, but I have your meds right here. They don't care. They don't care. Where am I going to sleep? Where am I going to lay my head? They cannot think of anything else until this main problem is solved. All right? Where am I going to sleep? What am I going to eat? What am I going to wear? That has to be solved first. Okay? What you saying? I know. It says stress is a key factor in the relapse into crisis for these individuals. After these basic needs are met, aka Haslow's, the remaining options can then be implemented. Okay? Let me read what y'all saying. I knew that Maslow's, yep, that would make sense because of Maslow. See, this is why I didn't like mental health class. I thought about the hierarchy of needs. They would have to do this before they can even treat their mental health. Correct. Monique said, when reading the question, I overthought their position that they would be doing first. Not around general. No problem. Whisper said, I was so happy when I was on mental health. I know that's right. Them therapeutic communication questions are tough. They are a doozy. Okay? All right. But does that make sense? I know. I swear, after taking the mental health class, like then I started being like, you know what? I do have mental health issues. Whether it's anxiety, whatever. But this class is making me be a mental health patient. Okay? All right. So let's go ahead and wait for it. Okay. Let me get something real quick. Yep. All right. So that was our last question, guys. To bring up. If you guys want to play the rest of the questions, like I said, I'm about to put it up on update the actual app so you guys can have these questions plus the rest. It's a 25 full questions. So just in case you want to continue on practicing, there's 5 practice questions per category: fundamentals, pharm, mental health, adult health, pediatrics. Those are the 5 categories, and there's 5 questions per category, ranging from 100 points to 500 points. So if you want to play it, play the full 25 questions, you gotta download the app. The app is the Nurse Sam. I'm trying to pull it up right now. Not right now, but Whitney. Wait for it. It's coming, I swear. 1 second. It's coming. Yep. Just whenever you're ready, phone. You just wanna. Yep. Nope. Take your time. Take your time. This is your show, clearly. Yep. My patience is about to run out in about 30 seconds. Yep. I'm trying to show y'all where to go. Wait for it. Wait. You've got to be joking. Hold on. This is literally, like, this has to be, this is not life, like, at all. Oh my God. You're joking me. Okay, so, wait, is this it? Kind of. Wait for it. I'm gonna just shut up until I find it. That's Tease Tuesday. What are you doing? You are kidding me. Nope. Wait. Oh my God. The app is the Nurse Sam, okay? I'm really trying to find it. You have got to be shitting me. Is this it? Nope. Here we go. All right. Let me just say what I'm saying. This is fun. Good job, everybody. Awesome. So proud of y'all. All right, so like I said, if y'all want to play the full version, let me update that now, child. Y'all can download the app. That's what it looks like right here. You can type in the Nurse Sam. It's called the Nurse Sam. That's the name of the app. The Nurse Sam app. So you can, it's free to download, free to play. Okay, when you download it, just hit NCLEX Prep and you'll see this little block right below, just like that. Tap here to play that free game so you can play the 25 questions. All right, we have 25 questions every week. Yes, awesome. Good luck to you again, Whisper. So what, the 28th? So what, on the 30th, I'm gonna be like, girl, Nurse Whisper, because I know you passed your NCLEX. I'm gonna check up on you. 2 days later, I'm gonna check up on you. I hope it's business days, but I'm gonna check up on you because the NCLEX should be very scared. I have 1,000% faith in you, and I hope you have 1,000% faith in yourself. So before you go and take that NCLEX, just do one of these, like just get your bang out the way and be like, let me just go ahead and just knock this out real quick. Makes a difference. Veronica said, is there an ATI Jeopardy on the app? There is like ATI Tees, absolutely. We do Tees Jeopardy on Tuesdays, and then we do NCLEX Jeopardies on Thursdays. All right. So let me go ahead and actually update that so y'all can have, where is it? So y'all can have, wait, oh no, where'd it go? What's today? The 5th, right here. Wait. Hold on. Okay. I'm updating that now. Hey y'all, hey. So you guys, maybe in like 5 minutes, you should be able to see the new questions. Like I said, 25 NCLEX questions for you guys to play. We did about, I think we did about 6 or 7. So if you want to play the rest of the 25 for practice, there you go. Once again, pediatrics, fundamentals, pharm, mental health, and adult health / med surg. Those are the categories. We do change up our categories, but those are going to be the ones for this week. Okay? Another thing, if you guys want NCLEX practice, you can download the NCLEX Arcade or the Ultimate Nursing School Bundle. If you don't have both and you want both, if you get both, you'll get 40% off. Not 40% off, I'm sorry. You'll save $40. So instead of buying both of them full price, if you get both of them, you'll definitely get $40 off that purchase. Now, as far as our winner for tonight with our points, okay, winner of tonight is definitely Whisper 22 with 700 points. Whisper, you won either an Ultimate Nursing School Bundle or NCLEX Arcade. I feel like you've won before, but I don't remember if it was for this or something else. So let me know if you have either or both. Whisper, let me know if you have the Ultimate or the NCLEX Arcade. Whichever one you don't have, you'll win. If you have both, then we will pass it on to the next person that won. It won't be future ER nurse because you already have it, I think. So we'll pass it on to the next person. But just let me know. Whisper 22. Yes, I remember you won the Ultimate bundle a while back. Yes, you can totally get NCLEX Arcade. I just posted something about that before. If y'all don't know what NCLEX Arcade is, or if you don't have it, I created that because I'm a visual learner. I'm an interactive learner. That's how I learn best. So like the no shade, but the U-Worlds and the Kaplans and the Hearst reviews were so boring to me. I would literally fall asleep every time. So I needed something that would actually grab my attention and keep it. So I created NCLEX Arcade. That goes through 200 of the top missed NCLEX questions on both RN and and LPN exams, and basically just reiterates it and goes over to you guys have that chance to answer what's mostly missed. It's commonly missed on the NCLEX. So if you do well on that, then you should do well on the actual NCLEX. And we have amazing results as far as people that's actually either using the Ultimate Bundle and or NCLEX Jeopardy. They come to NCLEX Jeopardy and then use NCLEX Arcade, pass, period. Okay, because practice makes progress. And that's all this is. Just another way for you to practice. But it's giving you the stuff just in a different medium. It's giving you the same content, but just in a different way that maybe it'll help you understand and comprehend better. And if you're a visual learner, that's exactly what it does. Okay? So, congratulations. Whisper, same thing as last time. DM me your full name and your email address, and that you want that you want NCLEX Arcade, and we'll go ahead and send that right to you. Thank y'all so much for joining me. We do these every Thursday. Clearly, whether I'm in vacation or not, I am committed to making sure you guys get the review you need, get everything you need to be comfortable taking the NCLEX and to be successful when you take your NCLEX, whether that's NCLEX RN or NCLEX PN. Okay? I've helped literally over 25,000 people have wonderful results. Okay? You're so welcome. You're so welcome. All right, so I'm going to get ready for my dinner. Y'all have a great night. Catch me. I'll do some more questions on my live. On my stories. So make sure you check that out. And I will see y'all next time. All right? Thank y'all. See you next week.